So when I think about the medical group revenue cycle, it stands out a little bit compared to the hospital revenue cycle. There's a lot of stakeholders that are involved, with the physicians being a key stakeholder that's unique in comparison to the hospital revenue cycle. And how we tend to think about it is it's about the overall margin and the overall operations of that clinical practice. And so when you think of the margin, there's a few levers that will improve the performance of that organization. The first one is just your top line revenue, or to grow your volume or your top line revenue. And you really have to look at your scheduling practices and ensure that you're, especially with electronic record, that you're set up to have really efficient scheduling practices and see as many patients as possible. The second piece I would say is looking at the expense, and with physician revenue cycle, there's so much volume that's going through, small dollar volume, and so it's important to have as efficient of technology as possible. So we encourage our clients to look at their billing processes and ensure that they have good editing software or tools in place so that the bills can go out cleanly the first time and not have to rework them down the road. And then finally, just standard revenue cycle collection rate improvement. You can achieve that through some of the basics that people are familiar with, really knowing what each of your operational units are doing, understanding how the work queues are structured, key reports, or key measures like denial rates, and looking at your write-offs, what's causing breakdowns throughout your process. There's a lot of metrics, I think, that are out there, and people are pretty familiar with them, but there's a few that I guess would reinforce. It's important to think of the front of the revenue cycle first and think of the volumes that are coming in through your practice, and really looking at physician-level volumes and work RVUs as a result, which I think most practices do that. But really drilling into that and seeing if there's opportunity to just improve the volume that's coming in through your practice. Second, I would say making sure that you're looking at the time it's taking to get a patient in the door. So from the time that a service is referred all the way through any sort of financial clearance steps that you have to take into when the patient is scheduled and in the door. By looking at that time frame, you're able to see what the access is into your site, and again, it supports the patient experience and can get more patients into your practice. From a more core revenue cycle perspective, looking at the clean claim rates, again, making sure you have as much efficiency in your process as possible, as well as your denials and write-offs, of course, so you can see where you may have any breakdowns. When I think about the accountability in a medical group organization, I really think that it needs to start at the very top of the organization. So it may not necessarily, that doesn't mean just the top of the finance organization, it really means the top of the top leadership of that business and that operation. So that may be the president of the medical group, or it could be the executives of a larger health system or a hospital system that has since acquired that practice. So the revenue cycle, while it may not be the top of their, may not seem like it's the top of their strategic priorities, it's such a critical element of how the business is run. So once you have the support at the top, I think that you need to have the tools in place in order to measure and hold accountable the different levels of the organization. So making sure that there's goals all the way from the overarching leadership down through the staff level of the organization, and that those goals can be captured and reported on a regular basis so that everybody knows what they're working toward and if they're successful.